My name is Dr. Ibanji Filani, the Honorable Commissioner for Health and Human Services in Ekiti State and the Chairperson of the Nigerian Health Commissioners Forum. This meeting that we've had is extremely relevant, particularly at this time. One thing that most people need to understand is that if you look at the entire value chain for service delivery, commodity supply is a huge cost driver, right, for service delivery and claims reimbursement. And so if we're able to work at the back end and ensure that we sort that out, then it becomes even more important. We can regulate quality of drugs provided. We can regulate the availability of these drugs and also the affordability of these drugs. This meeting provides us a unique opportunity as commissioners, but also as partners in progress with our partners at the federal government, the Ministry of Health, our partners in the PMGMAN and the entire bodies, and of course the Arcesm, to ensure that we work together and we collaborate in a way that guarantees that prices can be locked in. We build an opportunity and business case for procuring directly from manufacturers and also helping them to manage their own cash flow down.
Being together is a privilege that we must not take for granted. Therefore, today, let us make this meeting count. So, Honorable Commissioners, thank you very much for your patronage over the years. It has been wonderful. I have no doubt that your patronage has contributed to a minimum of 5% growth in our capacity utilization at our various factories. We hold in trust companies for, the ordinary Nigerian. And by your grace, those companies will continue to thrive and they will continue to grow and will continue to provide, for the ordinary Nigerian, to have a meaningful life.
We have a working document called Niger Health 1.0. Our vision, of course, is to provide equitable, qualitative, affordable, accessible, and acceptable healthcare services to female residents of Niger State to mitigate or reduce the unacceptable maternal and infant mortality rates, and also to improve our life expectancy. Supply chain transformation, we felt, should be what we should actually strengthen to get the health system going better. So we are already in marriage with 6 pharmaceutical companies. We have some challenges, the security situation, you can't move anyhow, the supplies, so that has actually affected us. But we put up a machinery for sustainability, that even after us, this system must continue.
Every politician will tell you, I will give you good health, I will build hospitals, I will make sure you have drugs, whatever. They will promise you anything in health. Now, matching the promise, the words to the action is where the problem is. It's essential that you have political money. And the political economy is important if we're going to move health. The governor in Kaduna State has exceptional commitment to health. He has over the years, made so much work and support in the health sector. And what is left is for us now to become more efficient, to become more responsive, and to work to get the dividends of what we have invested in.
The Yobe State government established the Yobe State Drugs and Medical Consumables Management Agency, basically to strengthen the state's public health care value chain towards achieving universal health coverage. Our goal is to reach 95% of our PACs by the fourth quarter of 2025. So all the 178 wards in the state have at least one health facility in keeping with the fulfillment of accessibility of quality and affordable health commodities in all communities in the state.
In line with us in the state, the state has 147 electoral wards and over 1,000 primary public health facilities. Over 90% of that are primary health care. The rest of which facilities are on secondary and tertiary facilities. Our situations are not different from other states, but with the managed scenario of PMGMAN and Arcesm, I believe the scenario has also improved over time.
Who knows the farmer PPP? Protect me, patronize me, and what? Pay me. So for the companies is yes, we are ready to give you quality. We are ready to give you that. And also we're able to look at pricing. But please, please, pay me.
Why do we choose to partner with ARC instead of engaging directly with state government or government establishment? But the challenge, the truth is that we've been engaging in the past, but the challenge is are those states or governments living up to those agreements? Over time, the industries have been burnt in terms of trust. For us, for the government to regain those trusts, someone needs to come in between. And I can tell you that that is the role ARC has played effectively.
MedZef is deeply honored to be one of the only pharmaceutical technology platforms here, really working on aggregating all of these amazing pharmaceutical products. We need to make sure that technology is deeply integrated across the country of Nigeria to be able to understand what the real-time demand is, the patterns, the information around what is necessary. This is a moment in history that we should all be very proud of. And so thank you so much, ARC, for actually being able to get this together. This is a very hard undertaking, but this is what the people of Nigeria deserve.
We are really glad for the PMG MOU that we signed with local manufacturers. With that, we have improved our availability of quality and affordable drugs as against what we had before. We have increased our reach to other facilities, and of course the prices have come down, so it's a very big advantage for us. So our main challenge is that sometimes the companies do not have all that we need. So we hope that by this relationship that we have, it will encourage the local farmer to extend their production to other commodities that they do not have.
We have a strategy plan of 5 years that says that we should deliver supply chain mandates, activities for efficiency and effectiveness in a way that is convenient with the public sector, in line with ensuring we have quality, affordable medicines. A key cardinal principle or area of the strategy plan is giving support, capacitation to the states to run their supply chain. Health indices have improved in terms of availability of commodities. We are seeing more and more by the day states reporting increased number of stock keeping units of medicines. We see increased health facility coverage for both the public health sector, tertiary and secondary health facilities. So for me, what I would suggest on how we can sustain this is, one, ensure as much as possible more states adopt the strategy. By implication, if they adopt the strategy, it means they are in line and in tune with the aspirations of that strategy, which embraces this PPP we are talking about. And that way, by the time they also want to implement that strategy, we'll see that cascade of the PPP model and then boosting of availability of health commodities and life-saving medicines for our country, Nigeria.